Being that I think that generative AI is going to be incorporated into healthcare, I want to ensure that all of our students are getting the necessary exposure to AI and how these tools work. Additionally, I want them to understand and know the limitations of AI-generated output, especially when prompting with medical information or questions. AI is able to provide a response, but students need to understand that there may be other pertinent primary literature sources, guideline recommendations that they would want to incorporate into that final answer or response that they're generating. My name's Dr. Kaitlin Alexander, and I'm a clinical associate professor with the UF College of Pharmacy, and I teach and co-coordinate a critical care pharmacy elective course for our Doctor of Pharmacy students. We have just a portion of our Doctor of Pharmacy students that take this course that want to learn more about critical care pharmacy and explore other critical care pharmacy topics that aren't covered in our core or traditional Doctor of Pharmacy curriculum. This course is an in-person, team-based course. Students work longitudinally, historically within their teams on a drug information assignment. And the purpose of this is to give them a drug information question that is a clinical controversy and give them practice delving into the guidelines, primary literature to come up with an evidence-based response that they would recommend for a real patient in the ICU. This year they're going to start by initially taking that question or prompt and putting it into AI and getting an AI-generated output. From there, I want the students to evaluate and critique the AI-generated output and then conduct their own literature search and evaluation. And then in the end, they'll come back together in their teams to synthesize all of their responses, their own literature search and evaluation to come up with a final answer to the question and a final drug information response. Critical evaluation of information, primary literature is so important for health professionals and in critical care pharmacy because ultimately we're coming up with a recommendation that is going to reach a patient. And so we want to provide them with the best care possible and ensure that their medication therapy is optimized. The last component of this drug information assignment, once the students come up with their drug information response as a team, is going to have them individually reflect on that process and how they see AI impacting their future careers and thinking about if they would utilize AI as a tool in the future in their own clinical practice. Using AI is really powerful to help teach problem-solving skills to students and critical thinking skills. And I think that it can be seen as a threat where students aren't going to critically think as much because they're utilizing AI potentially for their answers to questions or on their assignments. But I think if we teach them again that important step of critically evaluating the AI output and synthesizing it to make it their own, that actually can help strengthen their problem-solving skills and critical thinking skills, which is one of the core skills that I want all of my students to have when they graduate, because that's something that, irregardless of their specialty or path in the pharmacy profession, that is going to be important for their career.